I'm going to invite Dr. Muhammad Iqbal. Kindly recite the Holy Quran, please.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الرحمن علم القرآن خلق الإنسان علمه البيان الشمس والقمر بحسبان والنجم والشجر يسجدان والسماء رفعها ووضع الميزان ألا تطغوا في الميزان. The name of the Allah in the entirely merciful, the especially merciful, the most merciful. Thought the Quran created man, and the thought him eloquence. The sun and the moon move by the precise calculation, and the stars and the trees prostrate. And the
Sadaqallah.
heaven, Sadaqallahu Azim.
First of all, I'm going to be thankful to our International Forum for Homeopathy, organization for promoting homeopathy on a humanitarian basis to bring together the global promotion of homeopathy and to bring together homeopathic movements, activists, and activities worldwide under the one umbrella to promote homeopathy and serve the common public. So, I'm going to thankful to President Dr. Ismail Seth, Shaji Kudayat, Dr. P. Babu, Dr. Vijaja, Dr. Anil Kumar, Dr. Faisal, Dr. Muhammad Abdul Latif, Dr. C.G. Virgasi, and members of this forum, International Forum for Homeopathy, all members, I'm going to welcome and thank you for this International Forum for promotion. You are working, excellent working. Now I'm going to start with the anthem of this. Then I'm going to invite our chief guest. I'm going to invite the today's our chief guest, Mirza Nasruddin Mahmood Ahmed, Special Secretary Health, Ministry of National Council for Health Services Regulation and Coordination of Islamabad. Dear doctors, day doctors, homeopathic lovers, well-wishers, our special guest is none other than the Special Secretary of Health, who has been dedicated and tireless public servant for many years. Throughout their career, they have worked tirelessly to improve the health of our communities, to promote access to care, and to champion initiatives that benefit the most vulnerable among us. We are thrilled to have a special secretary of health with us today, and we look forward to hearing their insight and perspective on the challenges and opportunities facing our healthcare system. Please join me in welcoming our esteemed guest, the Secretary Health, and thanking them for their services to our community. Welcome, Dr. Sir Nasruddin, sir. Sir, please.
Thank you, Dr. Javed, for inviting me to this August forum. Since this is my first interaction in the forum, I am very much thankful to you and the convener of this forum. I appreciate the efforts of this IFPH for organizing this almost 1,000 webinar. It really shows their commitment and the love for the homeopathy, and they are really committed to promote homeopathy around the world. And it has its peers all over the world, and it's a good effort on their part. Since I am posted in government sector, so I am directly relevant with the policy making of on different areas of interest. By virtue of my experience of serving in health ministry, I closely watched the performance and the structure and the legal framework of the Homeopathic Council and the TIB Council. In Pakistan, homeopathy and TIB, which is also called Unani, are officially recognized by the government of Pakistan. And the government of Pakistan way back in 1965, framed its legal document, which is Unani, Ayurvedic and Homeopathic Practitioners Act 1965. Unfortunately, after 1965, there was no major amendment made in the act. Otherwise, there was a great room for improvement, seeing the best practices around in the world and the other contemporary changes which were required to be made in the setup and legal infrastructure of the councils. According to the act, which is common, but there are two councils, TIB Council and Homeopathy Council. Both are separate. They are working in silos, but their act is same. They are governed by the same act. Due to disintegration and working in silos, there is no interaction and the progress. In Pakistan, there are two councils, TIB Council and Homeopathic Council. Both are governed by the same act, which is called Unani Ayurvedic and Homeopathic Act 1965. So, since when I joined health ministry, I felt a dire need of intervening in the administrative and legal infrastructure of both the councils, because it was not brought to the level that the world. There are so many interventions and there are so many developments made in the world in all the areas which are non-allopathic. Pathetically, in Pakistan, like other countries, our healthcare system is mainly dependent on allopathic system of medicine. So this is one of the reasons that the homeopathy and TIB councils couldn't prosper as it was expected. And then there is another problem that there is less interest on the government side to promote these two councils. It has gained less attention of the government. And there are so many other factors. And one of the main factor which I give more importance is the public awareness, because the healthcare services system of Pakistan is heavily loaded with allopathic system of medicine. So people know more that system than the homeopathy and and TIB. So there is a dire need to give mass awareness among the people, and it is possible only when the homeopathic practitioner, who is the first person the people would meet, if he is up to the mark and practices homeopathy within the principles of homeopathy set by the Frederick Henneman. I have also witnessed another problem, that there is a problem of state of practice. The practitioner practitioners are coming up with their own interpretations of principles of homeopathy. So there should be a uniform standard of practice at least, because uniformity, because because of the uniformity, people would get to know and people would attract towards the homeopathy. And we should sensitize public that there are very ill effects of allopathic medicines, because these are all poisons. And the treatment through homeopathy and TIB are very safe. Their medicines don't have so many side effects, rather no side effects. So we should make the people understand this fact. This is only possible if our practitioners are literate enough and they know all the spheres of homeopathy principles, cardinal principles, and the good standards repertorization methods. So this is possible only. So as a government servant, I have taken the lead to review the law of the act of these councils. I am on it, and I'm doing my best to bring it to the best standards in accordance with the best practices around the world. So this is on my part. Thank you.
Today we are honored to have an opportunity to hear from our chief guest, Mirza Nasruddin, and to learn from their insight and experience. We are confident that their remarks will inspire us to continue working towards our shared goal of creating a healthier and more prosperous future for all. Please join me to extending a warm welcome to our distinguished guests, Special Secretary Health, and thanking them for taking the time to be with us today. Thank you, sir. Please welcome, sir, Special Secretary Mirza Nasruddin, please, sir. Please.
Thank you, Javed Sab. It's an honor to be on this forum, and indeed, being the Special Secretary Health, I have a duty to represent the cause of the Homeopathic Council here on this forum, and for Pakistan, most importantly for Pakistan. And as you know, and we have a
Sir, your audio, sir. Please, sir, audio, please.
Oh, sorry. I'm sorry. I just put it on mute. Can you hear me now?
Yes, sir. Yes, sir, please.
Yeah. Okay. Just a brief introduction. Being the Special Secretary, National Health Services Regulation and Coordination, the regulation part deals with the homeopathic as well. This is what we are dealing with it, and today I'm representing the Homeopathic Council on this August forum, and put forth the agenda that my Homeopathic Council is following to evolve through period, like since 1965. We had this law, but over the period of time, now they have come to a stage to reform it, amend it, and bring it in line with the latest innovations in the field. As you know, there's not much focus on research that has lately been observed. That since I came and just asked questions from the council members, worthy Javed Saab, who has been associated with this for a long time, and Khalil and other people who have got that penchant for homeopathic medicine. Over the years, I think we have a mushroom growth of colleges, and homeopathy becoming common in Pakistan, which 10 or 15 years back was unthinkable to have homeopathic colleges in Pakistan. So now that we have it, there's a need now to reform and bring uniformity in the legal framework to go on the affairs of Homeopathic Council. and Khalil, who will delve on that or might have already delved on this thing that they've been working on amending the Homeopathic Act to bring in line with the latest, make it aligned with the latest um, features in the homeopathic field. What I just has observed over the years that a lot more need to be done, especially in the research field. We have not yet seen any body or forum or some committee in Pakistan where a serious effort has been made to research on the subject. There's more of like people acquiring this knowledge through their interest from international interactions, but not much research has been done in Pakistan to focus on like um, homeopathic usage in trauma medicine, as has been done in Israel, or in formal medical education. It's a prerequisite and requirement to in Germany to undergo a homeopathic course. So a doctor, medical doctor, can also prescribe homeopathic medicines if he finds that there's a treatment for any illness in this mode of medicine. So this is what my focus would be, and my expectation is that now the council should more focus on this, and when they go for amending the new law, there should be a provision or framework be available for researching on this topic. And like just to focus, just I made a mention of trauma medicine being used in Israel, where some drugs are being tested for treating trauma patients, like arnica and Rustox, and there are other medicines which have been very effectively used in trauma cases. So that I need to see more of that in that our regular hospitals should have a dedicated homeopathic desk. And there's no much such realization among the medical practitioners who are averse to either to I have experienced. They would laugh at it. They see something, very laughingly would say, it's a homeopathic solution to something, meaning that a very simple or inane solution to things. But this is something not laughable unless you have experienced that. Our interest was generated. My father introduced me to homeopathic medicines. I know I would get tummy aches because, and my father would first give me a drug, homeopathic mixture, vermicin, by the name of vermicin. I still remember that. And I would take one drop of that. After a few minutes, I would be all right. So I would always call it a magic medicine. So I never believed in that homeopathicism until my father did that to me. So practically, this is what helped me or generated my interest in homeopathic medicine. And this is what is very common in my house. My father had a small briefcase, which he always carried the essential homeopathic medicine, and it a book which would give him that which drugs to use it for. So this is what helped me. And my daughter was always very scary of going to exams. So I asked somebody and just introduced that she will give her Ethusa and Argentum So this is what helped her overcome her fear, public fear. So this is some very magical. I always call it a wonder drug, wonder drop. It's just ek katra, meaning just one drop of it would help you. You don't have to drink anything, because the first introduction to anyone who has not used it ever would be surprised if one drop would make him better. This is just one drop of it. Yes, just one drop of it. That's enough for um, uh, treating you. And this, then I was the one who would always jump through the bushes and would be getting my encounter with the wasps that I had in my bushes and trees, and I'll always be stung by wasps or the yellow jackets. So the only thing that I used at that time, my father said, "This is the drug Apismel, and you have to take it." So I would take that, so that would help me treat that immediately and get off the pain and remove the pain, and it won't swell. There would be no swelling on it. In a day or two, I'll be better off. So, so I am an ardent homeopathic supporter, and my passion is that there should be more research on that. A research desk in the council and the special dedicated unit may help to introduce research in this field. And I think more of the practitioners who are working in this field should share their experiences, and those experience once collated would and that should be used as brochures with the general public. So what is that you can use to help your or the remedy for your or panacea for your ills. So this is what I have to say, and I think over to Javed Saab. This is
Thank you, sir.
section. I just started off without any preparation. I just came there, but I
sir,
was
really,
very keen to join and
I'm
and
really
this
grateful,
program.
sir. I'm really you have, sir. I'm really grateful. You have shared your own experience and as well as the official experience. Really, just I'm going to request one thing. Just stay for a while. I'm going to share a wonderful and magic case. Then you can more you will influenced about this. So thank just sir, please.
Okay, I am there.
Okay, sir. Thank you, Ji. Thank you, Special Secretary Mr. Nasruddin. And now I'm going to share a case, a wonderful case of a magic, as sir mentioned their own experience. I have a case, T lymphoblastic lymphoma, that is LBL, is type of the non-Hodgkin lymphoma, is the primary effect of immature T cells, a type of white blood cells involved in the immune system. It is considered a rare and aggressive form of NHL, primarily affecting children and adolescents, although it can occur in adults. With appropriate timely treatment, including intensive chemotherapy regime, radiation therapy, and sometimes stem cell transplantation, many patients with TLBL can achieve remission. The goal of treatment is eliminate cancer cells and achieve the complete response. The response to initial treatment is an essential prognostic factor. Patients who achieve the complete remission after initial therapy generally have a better prognosis compared to those who have residual disease or experience relapse. However, it is important to note that TLBL can be challenging disease to treat, and relapse can occur in some cases. The disease may refractory, meaning it does not respond well to treatment. In such situations, the prognosis can be more guarded. Actually, it was the indication. What is the? It's also called the non-Hodgkin lymphoma, T lymphoblastic non-Hodgkin lymphoma. Now, what is the symptom of this disease? These are the basically. I'm going to waste the time. Don't waste the time. These are the basic symptom of the disease. Now, here is a patient. I have seen the patient who is suffering from this disease, who is a T cell lymphoblastic leukemia. What is the common symptom? What is the symptom of this patient? Swollen lymph nodes, fatigued, weight loss, fever, respiratory system, abdominal symptoms, and bone and joint pains. These are the symptoms of which I have normal symptom of this patient. The patient which I have seen, what the patient was suffering from? Patient was symptom paralysis on left side. Number one. Number two, severe fits of epileptic fits. Enlarged lymph nodes, fatigue, fever, weight loss, respiratory system, diarrhea. This patient comes to me with this complaint. Now I'm going to say, you can see this. This is a patient named Hamza. I'm sharing a video with consent of the patient. Patient is sitting here in this forum too. This patient is suffering from the left side paralysis. This is acute and aggressive. Basically, this is evidence-based disease, evidence-based treating acute fatal and cancer. This is a fits. It fits occurring after 1 or 2 hours. The interval of this fits. This kind of fits, and these are severe kind of fits and convulsions. Now, after this patient I have treated single homeopathic medicine. I'm not mentioning the medicine and the how to take the case because it is a part of the academic part, but I'm sharing just the evidence base and what I did it with the patient and with the homeopathic medicine. Only single medicine is used here. After the 1 day, this patient comes with the paralysis, and after the 1 day, you can see this patient after the 1 day. After 1 day, patient fits was disappeared, and only its little finger they are moving now. Fits was disappeared after 1 day, and patient is moving one finger. This is after 1 day. It is a second day. You can say now it's in second day patient can move their legs. At third day, patient can turn their side. At fifth day, patient is standing here. You can see it. After the 7 days, patient is after 7 days, patient visit my clinic with stick. This is the case which I have shared. Now I'm going to introduce this patient with Hamza. Basically, this is the evidence-based case of the acute and as well as cancer and fatal disease, aggressive disease. Aggressive disease. Now, Hamza is sitting with me. Please, you can see it. Hamza, yes, and this is the patient by Hamza, and IPR is Mr. Kamran, is a relative and a brother. Hamza, what is your Mr. Kamran? Tell me after a treatment, what you have seen it. What is the actual condition when the patient comes to me, please, Mr. Kamran.
Sir, on March 7, Hamza was diagnosed as T-cell lymphoma. We have started treatment from Anmol Hospital allopathic treatment on 9th March 2023. Hamza was admitted in the hospital with the case of fits and paralyzation of left side. For 5 days he was admitted there. And after that, on the 24th of the March, they have discharged us, saying us that you can go anywhere else where you can treat this. But we don't have the treatment for this purpose. We are only treating here T-cell lymphoma, not the fits and the brain problem. We were quite hopeless and we came back home. We went nowhere after that. On the very next day, some friend from far or near tells us about Dr. Javed Akhtar. We were half-hearted and went to you, sir. In Islamabad, it's quite far away from our destination. It's about 4 to 5 hours traveling, continuous traveling. On the first day, he was treated for the fits.
This is the diagnosis of the patient after CT scan, excision biopsy of the lymph
Yes,
gland.
yes,
This is the
yes,
report I
yes.
shared.
Axion biopsy was taken on 27th of Feb, and it was reported on the 7th of March. Axion biopsy report was printed on 7th of March. After that, we have several tests, including CT scan and other tests.
Okay,
And
Kamran, do not waste the time. Okay, what is the basically? I'm going to ask. This is a thank you. Introduce me to Hamza. Hamza is here. Hamza is now is
yes,
excellent. There's no lymph enlarge, no respiratory complaint. Okay, Hamza, you can tell me in your own language. आप उर्दू में बात कर सकते हैं. But what is your problem now? How it is the 7? I think it's 7 weeks. It's the after the 7 weeks. I is under the treatment because it may not relapse again. So I have seen all the lymph glands are normal, no complaint even. What is your opinion? अब कैसे हो तुम? How you feel now, Mr. Hamza?
लगा शुक्र सर ठीक ठाक
How you take खाना पीना तुम्हारा कैसा है अभी? बुखार वगैरह सर दर्द anything? Any complaint? कोई complaint आपको है
नो
सर?
सर नो कोई किसी किस्म की कंप्लेंट
Are you are taking normal? Your diet taking the normal diet you are taking? आप normal diet खा रहे हैं सारी जिस तरह खाते हैं?
जी सर
sir,
Are you
the best-
walking? Okay, चल कर बताओ मुझे उठ के चल के बताओ everything you are fine?
जी सर
Okay. This is the basically I'm going to share evidence based. The non-Hodgkin lymphoma, if you are treated in the chemotherapy, it will takes 8 months. But after that, it's most probably it is the prognosis is not as well as good. But it's a little bit, it's a poor prognosis. The patient is cured with the homeopathic of the single homeopathic medicine. Thank you, Kamran, Mr. Kamran and Hamza. Thank you for joining us. Thank you, please.
Thank you very much, sir. Thank you very much. I want to say thanks to you and your homeopathic firm as well, and thanks for being a part of the 1000-day homeopathic webinar. Thank you very much, sir.
Okay, thank you, Ji. Thank you, Ji. Thank you. Okay, now I'm going to invite the sir. I'm grateful, sir, Special Secretary sir. I'm really grateful. Thank you for you are sitting with us. Now I'm going to invite the Dr. Eli Bucks. He is an eminent homeopath. Dr. Eli Bucks. Eli Bucks is a member National Council for Homeopathy and chairman Rules and Regulation Committee of National Council for Homeopathy, Government of Pakistan. Dr. Eli Bucks basically we used to say only Eli Bucks. Thus I'm write the word Eli Bucks. Eli Bucks is an eminent and he knows the rules and regulation. He knows the homeopathy as well as the acupuncture tip. He's a really, I'm very impressed to such type of the personality who is guiding us and doing the excellent work with their homeopathy and as well as the government level, as well as the private level, as the humanitarian basis. Thank you, Eli Bucks, sir. Please come to us, join us, please.
I will first of all welcome and appreciate the whole team of International Forum for Promoting the Homeopathy on completing the thousand webinar sessions. It is a great moment for me to be a part of this forum, and I will encompass me simply for the affair of the Council of Homeopathy. As I am the member of National Council for Homeopathy, and our Homeopathy Council consists of more than 20 members. Some members are from by the will of the people of homeopath or by the homeopath, and some are belongs to nomination from the provinces and the federal government. I am one of the nominated member of the federal government. As it is a known fact that every forum has some chit chat and opposing thing. If there is a cry, there is a discussion, there is a noise, it means there is a ground where something is going on. I appreciate all of my colleagues who are working for improvement of homeopathy by means of opposing, by means of affirming, by means of new development, new suggestions. I don't think that every person has same bent of mind, same dimension. Everyone thinks in different dimensions, and everyone has to accommodate each and every person. We have different dimensions, and we see that we are developing our system of medicine. If there is a mic is open of someone, please stop it. Please mute it. And in during this memberment of National Council for Homeopathy, I have visited so many colleges. I don't see that each and everyone is sitting there is not up to mark. Each and everyone has affinity and capability to improve the educational system of homeopathy. And as you know that our colleges and our institutions are the nursery of homeopathy, and we can improve them. If there is infrastructure, then there is a chance to improve the things. We have more than 130 colleges. We have more than so many institutions for bachelor degree or for the graduation degrees. We have more than 2 universities where from degrees are awarded. It means there is something far on development path. And we hope that in Pakistan, we will improve. We are improving and more improve and more develop the homeopathy. And that's all from me. Okay, over to Mr. Javed Akhtar.
Now I'm going to invite the homeopathic physician and consultant, Dr. Arshad Mas. He's an academic and professional qualification. He is a BSc, DHMS, BHMS, and also is a NCT. He is a diploma in TIB. He's a very doing hard work in homeopathy. He's a devoted, sincere. I'm going to say journalist too, a homeopathic journalist. Sir, Dr. Arshad Mas.
जावेद साहब बहुत शुक्रिया. Dr. Javed Saab invited me to attend this seminar. I am very grateful to the organizers of this beautiful and knowledgeable forum, IFPH. I would like to say that the Pakistan is the second largest country of the world where the homeopathy is recognized on the official level. In 1965, the Unani Ayurvedic and Homeopathic Act was passed by the Parliament. And now we have 8 years have gone, and the homeopathy is flourishing in Pakistan. The government hospitals have the homeopathic doctor suites where these homeopathic doctors are practicing and treating our patients. There are 2 types of homeopathic education in Pakistan which is prevailing. One is the diploma DHMS study. It is after previously it was on the basis of metric, but now recently in the last year the Parliament of Pakistan have passed this bill that the basic qualification for the homeopathic students will be FSC. This is a great privilege and honor for us that the Parliament of Pakistan have recognized our system as a medical system. And Second is the Bachelor of Homeopathic degree course is going on in Pakistan. Almost 8 universities in Pakistan are conducting this homeopathy degree course. Even a medical university, KMU, Khyber Medical University, is also conducting the BHMS, same on the ground of MBBS. As the MBBS doctors can get admission on the basis of FSC, and our BHMS students will also be enrolled on the basis of FSC. After 5 years of education, the KMU is awarding MBBS degree to medical doctors, and the same university is awarding 5 years degree program to our homeopathic students. It is we thankful to Gauri Saab, the previous director of homeopathy in Pakistan, with the help and effort of him. Now the homeopathic doctors can undergo 1 year internship or house job in government hospitals, same on the ground of MBBS doctors. So now in 1965, when there were no diploma holders and government given a chance to homeopathic doctors that they can register themselves in the National Council for Homeopathy on the basis of interview. And after 58 to 57 years, हमारे 57 या 58 साल के बाद अब हम बिल्कुल on the same ground of MBBS medical doctor, we are now studying homeopathy in Pakistan. तो ये सबसे बड़ा ऑनर है पाकिस्तान के लिए कि पाकिस्तान दुनिया का दूसरा बड़ा मुल्क है जिसमें होम्योपैथी ऑफिशियल लेवल पर रिकग्नाइज है. हमारे साथ एक नेबर में इंडिया मौजूद है जहाँ पर होम्योपैथी हो रही है. सो फार 2 लाख यानी कि 2 लाख तकरीबन 200,000 homeopathic doctors, including DHMS and BHMS. They have been registered with National Council for Homeopathy. National Council for Homeopathy is doing very good job in Pakistan and for the promotion of homeopathy. And we congratulate to the President, Dr. Rao Ghulam Murtaza, and the Registrar National Council for Homeopathy, Dr. Ahmad Adin Rame. Both the personalities are going well. And on this, Dr. Javed Akhtar, who is our teacher as well, and my colleague as well, my classmate is as well. Dr. Javed Akhtar, Dr. Eli Baksh, and all other honorable members of the National Council for Homeopathy.
Thank you, Ji.
They have
Thank
put
you.
good effort in the recognition and promotion of homeopathy in Pakistan, and we are
Dr.
thankful to
Mas,
all
please
of them.
conclude it. It's very
We are
short time.
thankful to all of them. And now I offer my services, as Dr. Javed Akhtar said, that we are doing something for the betterment of homeopathy in Pakistan. I offer my free services. If anybody who wants to take any work from us, we are ready to work with you as a team member, and our services are free. Thank you very much to the
Thank you,
organizer,
Dr. Warshad Salim. Thank you.
the
Thank you. So
moderator,
nice.
Javed Akhtar, and the organizer of the IVF. Thank you, sir.
Thank you. I'm going to invite the Dr. Hafiz, Hafiz. Now he's joining us, and he's a principal of the associate professor and principal of the conventional medicine college of homeopathic Bahawalpur University.
Thank you very much, Dr. Javed Saab, for inviting me here.
Sir, please.
Please share my presentation kindly. I will.
Okay, you
start
can
writing.
see it. I've shared it. You can see the presentation there.
जी, मुझे हमें presentation नजर आ रही है. We can see the presentation. Please go ahead. Go ahead.
Thank you
Sir,
very much.
speak it, please.
I have been introduced by Dr. Javed. I am serving as associate professor and principal in University College of Conventional Medicine, the Islamia University of Bahawalpur. First of all, I will introduce a little bit about my institute. Actually, my institute, University College of Conventional Medicine, the Islamia University of Bahawalpur, is the pioneer institute launching the homeopathic system at graduate level in Pakistan. The Islamia University of Bahawalpur is the first public sector institute, first public sector university degree awarding institute who understand, who thinks about the development of homeopathy and launched Bachelor of Homeopathic Medical Sciences, which is a 5-year medical degree program. And as the last our speaker was explaining about the universities where this BHMS have been launched till now, but we being the pioneer institute here offering BHMS since 2001. After BHMS, we have already launched here MPhil in homeopathic medical sciences, and soon, inshallah, PhD in homeopathic medical sciences will also be offered here in Islamia University of Bahawalpur. And I hope we will be the pioneer one all over the world in the matter of research and the development for the system of homeopathic medical sciences. Here is in my presentation the objective of the course, which is the Bachelor of Homeopathic Medical Sciences. We here teach the student about the classical homeopathy and the modern method. We teach the students about the advanced therapeutical knowledge and the practical skills of the students. We also working on the research orientation of our graduates here in university. Next slide, please. This is about the scope of BHMS. This is all about the scope of BHMS here in Pakistan. We are still working, all the associations, all the organizations and the council still working about the scope of homeopathy in Pakistan. But here we can see that there are some government level jobs in where the BHMS students are performing their jobs in national and international organization, either clinical practitioner and as the other sectors of the health sector in Pakistan. Next, please. Here, which is actually which I actually want to explain here in my presentation, which actually I want to tell about the some completed research work by our graduate and the postgraduate student here in Islamia University of Bahawalpur. After BS, we are actually focusing on the research and development. We have already established a phytomedicine and the homeopathic research lab here in our college, and many students are working here. So I want to show here briefly the completed research project of homeopathic students here. You can see these are only the topics I have mentioned here. These are only the title of the research project which have already been completed by our homeopathic graduates, like
Please, sir,
evaluation of antipyretic activities.
Sir, mute everyone, please.
These are the works of the sir.
You can see these all are the research topics, are the research projects which have already been completed and compiled by our graduates. You can see that the titles and the results. Similarly, this is here. You can see the we actually have compiled here the introduction a little bit and the result which was obtained by these students. This is actually the slide view of our all research projects which have already been conducted by our research students.
And now I'm going to invite the Dr. Amir. Dr. Amir basically working as a UAE, and Dr. Amir Salim Amir. Dr. Amir Zahir Malik, Vice President, Health Ambassador in Arwa, UK, Member, Supreme Council, Arwa, UK, Ops, Cabinet Member, IFPH Member, BLS King University of UK, and American Heart Association, USA, MS Scholarship from the Mountain William University, USA, Fazla, and he has a great working. His qualification is a BSc, and also he's working MSc in biochemistry, BSc, and is old Ravian to DHMS and RHMP in the UAE. He's working. Okay, Dr. Dr. Ahmed Nazir, please, welcome you. Please join us.
Honorable Sir, Dr. Javed, first of all, thankful to for your kind arrangements today. Second, greetings, namaste and salam to all. And today I am thankful to IFPH, first of all. This organization, honorable organization, International Farm Promoting Homeopathy, was created in those days when the world is suffering from the chronic situation, the critical situation, the pandemic 19. The greatest crisis in the world, the holy places are hijacked, especially the temples, the churches, the masjids, all are hijacked. SOPs comes within 10 days. Explanation how the SOPs discovered just in 10 days.
Sir, you have 3 minutes only, please.
Yeah. So during that time, the seniors, the visors of IFPH, the creator, the promoter of homeopathic medicines, they create a platform which unite all homeopathic doctors from the world on one platform, international platform promoting homeopathy. During that critical time, when everything was hijacked on the name of the crime, COVID-19, because it's never a new virus to the world, to the humans, as the humans are on the earth. We are catching the viruses and bacteria disease known as zoonotic disease. It's never new to us. And secondly, major thing that the biggest pandemic in the world starts from 1316 to 1617, the Black Death, the Black Plague. It's more than 400 years in the world. And after 400 years, the SOP is only one, just clean the place you live and eat where you work. And second is that the first generation vertic is scoring that Black Plague. This is the first time in history. Close the whole world and freeze the world, because these are the secret rulers who have used this conspiracy, global assassination, the virus. They invent a pseudo and IFPH is the first organization in international level who give the cure and have fights on the scientific medicine, medical evidence, and they give the petitions to who? To the government of Kerala, all other governments. They have research centers. They prove all that all fake vaccines and COVID virus precaution SOPs are introduced. They prove the medicine as that time lot of countries are sleeping. So IFH, our seniors, we should all should Honorable Dr. Anilana, Honorable Dr. Sir Ismail Say, Honorable Sir Shadikhodiyat, Honorable Ismail is the president, and Honorable Shadikhodiyat is vice president, Dr. Manoj, Dr. Isaac, Dr. Joe, Dr. Baba Khan, Sir CFK, and Honorable CJ Vigas. And there is a whole team in front of us and behind the scenes. So God bless you all. I have to just complete 5 things.
Okay, please.
Because this is an international agenda, I just give one.
Okay, please.
First thing, our father homeopathic, founder of homeopathic and science was the allopathic doctor. He was also a and the father of molecular medicine, because he was MBBS doctor. Father of molecular medicine is Asclepiades, and father of clinical medicine is Hippocrates. Our medicines on international level, they must be ranked as molecular medicines because they have ability to cure the cancer. Very important point. Regarding this issue, helped by the platform IFPH, systemization of the research work should be globally, should be proved, should be together on one point. We have to fight that mafia which was homeopathic their rights. Because since 1755, the medicine is from that historical right. Allopaths wants to cure us. So to come over that issue, the medicines which help to cure cancer, also known as novel medicines. But fortunately, we are proved, we have the pharmacopoeias, British, American, German, that our medicines are novel as well, and they have the ability to cure the genetic error. This is very important. On the base of 4 molecular base, homeopathic medicines have the ability to work on the basic 4 molecular theory of the genes. We are not claiming so big as the virologists are being fool the pupils by saying these words that the pandemic have taken over as the name of COVID-19, as now they are saying monkeypox, which is a sexual transmitted disease. So my request to you that we have to submit our results to WHO and NIC, National Internet Center of in US. And in the Second World War, World War I, II.
Dr. Amir, please, short at the time is very short. Please kindly.
I will finish. This would be the last sentence. National Center for Alternative Medicine in after Second World War, the father of bomb, John Oppenheimer, who refused to take his Nobel Prize, had been said that science is a sin. After that critical destruction of plutonium and uranium bombardment, homeopathic medicines place #1 in the world to put the effects of radioactive isotopes. So I want to thanks my from thanks from bottom of my heart.
Thank you. Thank you. Thank you.
Love you all.
Thank you. I'm really grateful. I'm really grateful.
And thanks for IFPH who have this heart to call all countries on one platform.
Thank you. You are really excellent work, Dr. Amir Nazir. You did excellent work.
Father of homeopathic is German and mother of homeopathic is India. So God bless you, all of you, sir. My special salam, namaskaram to all of us.
After this, I am sharing. Thank you, sir. Just I'm sharing a small case of 1 minute because I'm going to tribute to Master Honeyman. A small case, how much homeopathy can work in the those cases where are very aggressive, which are not curable in allopathic science. That is curable in homeopathic science. Just I'm going to evidence base. Here a small case. Just I'm going to the figures of this case. Chronic kidney disease, CKD. It was poor CMD, bilateral renal cortical cyst. It was the size of the kidney cortical cyst. This was the size 3.1 and 2.77. Left cortical cyst, and urea was 144 and creatinine was 11.4. It was entirely dialysis patients, and this patient, the GFR rate is 6.08, less than 15 is the severe CKD disease. It is a grade 3 basically. This is a grade 3. This is a report finding of this grade 2 and also it's mentioned grade 3. CMD, chronic medullary disease. Okay. Now after the 2-3 years, creatinine was average. It's about after 2 to 3 years, 2.5. GFR rate is going to be raised 30 to 50, and with single homeopathic medicine, only single. And the last February 2022, bilateral cortical cyst, the kidney, this was the 22. The size was reduced to 2.8 and now gradually down. The urea 61 and creatinine 3.4, and the GFR was 30, and it was grade 3. After the last 1 year, what has happened? Into 2022 and 23, GFR 30 to 50, creatinine 2.4. And the thing which is to be mentioned here, that the patient is going to be in grade 1. May to the bilateral renal cyst, size reduced 1.8, urea 35, creatinine 2.5, and GFR 36. Grade 1 with the preserved CMD. The CMD also poor, it is converted to preserved, and now it is the stage 3, 2, and 1. Now it is a grade 1, and patient is absolutely normal for the whole year, but the pathology is becoming very good now, going to be right direction. And the cyst size is reduced, GFR is increasing, and the CMD is due to CMD, the grading of the intensity of the disease is reduced to grade 1. this is the I'm going to now. This is the great tribute to our master. I request to all of the audience and all the homeopathic lover, lady doctors and homeopathic doctors, well wishers. I'm going to request you, please, silent for 1 minute, please. I'm going to invite Dr. Nasser Ahmed Chaudhry Sahab. He's an ex-president of Homeopathic Council, and really is a wonderful. He's working, devoted, sincere, and eminent homeopath. He's an honest and hard-working person. He toured a lot of the world. Just, sir, I'm going to request you just 1 or 2 minutes, please.
Good evening, everybody. I'm grateful to Dr. Javed Akhtar for introducing me to this August forum. Actually, I was interested to know that the main objects of the International Forum for Promoting Homeopathy. As far I am hearing this in this meeting, I'm not able to hear anything. Anyhow, such forums play an important role in promotion of any profession. So homeopathy require much hard work for their promotion. So far as I know, World Health Organization has announced slogan, its slogan for health for all. And this task was to achieved by 2020. But up to 2023, nothing is achieved by the WHO. It is all due to one thing, that WHO and all other governments, including government of Pakistan, their budget is more than 90% spent on one system of medicine. And homeopathy is only surviving on the public level. So we are surviving on this was a very good opportunity. Mirza Nasiruddin, Special Secretary of Health, was present here. So now he is gone. So we should work for the promotion of homeopathic system of medicine. And this forum can play an important role, what I feel, for unity of homeopaths, for promotion of profession, and for providing opportunities for public awareness also. So I know it very well that we are very short of time. So I conclude it here. Thank you very much for introducing.
Thank you, sir.